2001, the Ugandan government integrated community health workers into the National Action Plan for Health in delivering primary health care to every community in Uganda. And the purpose is to deliver basic health education, to treat minor illnesses, and to deal with childhood illnesses as well. However, they face many challenges in doing this work. Some of the challenges are structural, so things like it's very difficult to get around, so transport is very difficult, getting the materials for their work as well, and then basic training as well. They had basic training, but then no further supervision, so ongoing training and support was also an issue.
So we have designed a program to support and strengthen the community work program, focusing on the training, supervision and motivation. Under training, we've had several workshops focusing on their various aspects that they support in their communities. Under supervision, we've been able to provide them with motorcycles, as well as train their supervisors to ensure that they work closely with the CHWs. Under motivation, we've been able to provide them with non-financial incentives to ensure that they are well motivated to do their work, including gumboots, umbrellas, t-shirts, and many others.
By addressing the barriers of limited training opportunities and low morale in the communities they work with, we've upskilled the health workforce, improved community health worker retention and competency in treating childhood illnesses. Our work continues to strengthen the health system by working with over 900 community health workers in a range of programmes.